So if the neurologist at the outset could have directed us to a specialist, an MS specialist sooner, so an MS nurse or an information program that we could then look at ourselves, and that would help us not only with Eleanor but with our family as well, and even the schools. So the schools might not have got anything, but we could have discussed the schools at that point for them. It's not a minor illness, but it's a rare illness in children, so schools aren't really aware of it. So I guess it's the experts, the technical experts, the policymakers' job to provide better information, so that we can, as I say, I'm confident enough to go into schools and talk to the schools about it. Is there a program in place so we can pass some information on to the schools so they can look at it for their patients, for their students that are involved in that, and so they can direct it down to their teachers? So that would probably be a help. The other thing I thought of in that space is, can some experienced caregivers, so me a few years down the line, 4 or 5 years, somebody else gets diagnosed with it at a school, 14 years old, can me as an experienced caregiver go and give a talk to the parent, to the teacher, and even have the healthcare professional there? But can we get some experienced people to help that student? Because if we'd got somebody in school to help Eleanor at that point, it would definitely have improved Eleanor's situation in the first few months at school. Earlier intervention of all the things we talked about. So the psychological support, rather than wait 9-12 months, how do we get that earlier? Because 12 months down the line, we were in a far different place. We were comfy with everything. We needed some support initially. So it's how do we get that in place? We didn't get access to a multiple sclerosis nurse for 12 months because Eleanor was 15 and there wasn't one locally, so we had to wait till she was 16. So can the policymakers do something where Eleanor could have had access to an MS nurse within the first 2 or 3 months? Because that would have made it far clearer and beneficial, because now we've got access to that MS nurse, we are in a different place, and every time we want to speak to that nurse, we ring her up and they give us the right answers and relax us and make us comfortable about what we're asking. From an educational point of view, I think it's important that we get something in place that, whether it's an information booklet, whether it's some online process, that the school, we can say to the school, my daughter's got diagnosed with multiple sclerosis. If you just look on the system, you can see what help you'll be able to help our child with, and therefore it may help you as a school. Whereas, because Eleanor's head teacher is really passionate, but she didn't know where to go to look for it. Whereas she got that information in place straight away, that would have been key as well. And I think, obviously, these youngsters getting it 5-6 years old, but for Eleanor being 15, I think the link between the paediatric and the adult services, the link could be a little bit better. We've kind of had some challenges in terms of who's in charge of us. Everyone is fantastic. Everyone knows their job. It's just there seems to be certain things held back by the system. And I think if we can just work together, the MS societies, the education people, the neurologists, the experts around the table, if we can work together and relax that and be more flexible, I think that will help Eleanor and it'll help future generations of MS sufferers upon diagnosis.